Despite how common sickle cell disease is, I've realized that so many people still don't understand what this condition is. So I'll just break it down to make it very simple. Sickle cell disease is a genetic condition that affects our red blood cells. Normally, red blood cells are supposed to be round or circular. What happens in sickle cell is that those red blood cells become sickle shaped. Imagine a crescentic moon, a curved moon, or the sickle that is used in to harvest crops. Now those red blood cells become rigid. They're not as flexible as they're supposed to be. Normal red blood cells are supposed to be flexible so they could squeeze through very small blood vessels. Sickled red blood cells are rigid, and it's very difficult for them to squeeze through very narrow blood vessels, which we call capillaries. So what then happens is that these rigid sickled red blood cells easily get trapped or stuck in those very narrow blood vessels or narrow tubes, leading to blockage. And if you are aware of sickle cell, you find out that a lot of people who have sickle cell every now and again come down with painful crises, either bone pain crisis or chest pain, what we call acute chest syndrome. And if the blood vessels that carry blood to the brain are blocked, then obviously the risk of having a stroke is increased. The risk of having shortage of blood vessels to the chest, to the lungs, or if it happens in the intestine, then it can lead to what we call mesenteric ischemia, where certain portions of the bowel or small intestine or large intestine could actually become dead, and then a person might need emergency surgery to remove those parts. If it happens in the bone, it causes severe bone pain and obviously sometimes even death of the bone marrow. So this is what happens really. Normal red blood cells generally will last 4 months, which is 120 days. But in sickle cell, those rigid sickle red blood cells don't last very long. They get destroyed in 10 to 20 days, so less than a month. You can imagine that. So what happens is that because people with sickle cell disease lose their red blood cells frequently, and obviously their blood levels or hemoglobin levels will become low, and that's what we call anemia. Now, another thing I've come to realize is that many people don't really understand the inheritance pattern of sickle cell. Many people would have heard that someone that has a hemoglobin genotype of AS shouldn't marry someone that has a hemoglobin genotype of AS. But there's no really clear understanding of how that inheritance happens. Sickle cell disease is inherited via a pattern we call autosomal recessive, which means for a person to have sickle cell disease, they need to inherit a copy of that defaulted or abnormal gene from both the mother and the father. So imagine a father with AS. The A is normal, the S is abnormal. The mom is AS, the A is normal, the S is abnormal. Now, if the child inherits the S from the father and the S from the mother, they will have sickle cell. If the child inherits the A from one parent and the S from one parent, they will have AS genotype, which we call sickle cell carriers or sickle cell traits. If the child inherits the A from the father and the A from the mother, they will have a completely normal genotype. Now, for every pregnancy, there is a 1/4 or 1 in 4 chance that someone who is born to both parents being AS could have sickle cell disease. So 25% chance in each pregnancy. There's a video I saw, a guy, he's a sickle cell warrior, and he probably made it, I'm not sure if maybe that's how he understood it, or maybe he was just trying to create content, but I know a lot of people also understand it this way. He said he's the last child, he's not even the first child, of his parents, and he has sickle cell. Now, some people think that 1/4 means if the couple has 4 children, only 1 out of the 4 children will have sickle cell. No, that's not what it means. For each pregnancy, so if a couple has 4 children, which means 4 pregnancies, for each pregnancy, there's a 25% chance, 1 in 4 chance that child will have sickle cell disease. Which means if they have 4 children, there's a likelihood that the 4 children could have sickle cell disease. or those 4 children might have a completely normal genotype, or those 4 children might be sickle cell carriers or have sickle cell trait, the AS, or it could be a random mix. One child could be AA, one child could be AS, 2 children could be SS. So it could be a very random mix. Each pregnancy, each conception is different. 25% chance in each pregnancy. And this explanation applies to all other conditions that have an autosomal recessive, inheritance pattern. Things like cystic fibrosis, for instance, and other conditions.